We are back with our doctor panel, and we have a very special guest joining us today. Dr. Oz is here, along with Dr. Jill, Dr. Iyengar, Dr. Carm. Always good to have you here.
All right, and let's talk about sex.
Sex it is.
Why not?
Yes.
Why not?
Yes,
Why not
indeed.
talking about sex? Okay, but particularly, how soon after someone has a heart attack is it safe to have sex?
Dr. Iyengar, you can start with
let's
that.
be honest. Hundreds of patients that or thousands of patients that have heart attacks, weekly in this country. You usually ask, when can I get back? When can I get back on that horse? When can I start doing this again? And let's be realistic. There was a teaching not too long ago that walk up 2 flights of stairs. You'll be fine after that to engage in sexual activity. But I think the important thing is what caused a heart attack to begin with. Is there risk factors that we have to change, as opposed to just fixing the actual blockage, like the cholesterol levels, like blood pressure, smoking. So before we tell someone, hey, go back to doing an aerobic activity of any sort, because your heart rate, your blood pressure, your hormonal levels all increase during sexual activity. Let's be honest with ourselves. Is there other risk factors that we need to kind of adjust before we tell them, hey, your body's fit to go back into that ring?
Well, Jill has unique insight on this, by the way.
I do. Did you know the Mayo Clinic came out and said that you're actually likely to die during intercourse less than 1% of the time?
Good.
But
Good for all of us.
Yes.
less than 1% of the time, 75% of that 1% are men having extramarital affairs.
I knew it.
What do you think, Dr. Oz?
Yeah, but see, so I guess that, for doctors, we look at that as tragic. The wives might say, justice.
Yeah.
Good one.
true.
Well played. I love that.
Oh, okay.
All right,
Moving
let's
on.
go into
Immunotherapy?
Let's do it.
Okay, is it a miracle cure for cancer? There's been plenty of buzz around about the concept of a patient's immune system attacking a malignant tumor. Who knows more about that one?
It's so exciting. We all know that there are viruses that cause cancer. For example, HPV, human papillomavirus, is one example. And we have a vaccine against that virus so we don't get the cancer, cervical cancer. However, now they are taking cancer cells and they are manipulating them in the lab and injecting them back. And now we have vaccines, and we are developing even more that can actually fight the cancer. And it's just so exciting. It's blowing up. It's huge. We have it right here in Tampa.
Well, you mentioned the HPV virus, and Michael Douglas has just been in the news for some controversial comments about basically saying that he could have gotten his throat cancer from oral sex. Dr. Oz, what do you think about his comments, first of all?
First of all, he's very brave to talk about it openly, and he commented last night that he's become the face of oral cancer, and he should become the face of oral cancer because most oral cancer is not caused by cigarette smoking and drinking alcohol anymore. It used to be. When all of us were going through training, we were taught that was dogma. But the majority of oral cancer now is caused by this virus, HPV, and that's also true for anal cancer, penile cancers, and of course cervical cancer. So it's a bad virus. Not all the strains are dangerous, but when it gets into your body, and men have a more difficult time getting rid of the virus than women. Most of us, when we get the infection, which happens within the first 2 or 3 intercourses of our lifetime, we'll throw them from our body. That's why we don't do pap smears in young women. Am I right?
That's true.
Isn't that HPV virus, though, in most of us? I hate to say.
Isn't it dormant in
It's
most of
1
us?
in 4 people have the HPV virus. If you've had intercourse with more than one person in your lifetime, you're likely to have it. But Dr. Oz, I'd like to say that I'm happy that Michael Douglas came out about it because in my office now I can talk about vaccination. I mean, we can't do that enough, and protection from sexually transmitted diseases.
And it's not something a woman can easily discover on herself, right?
No, you won't know you have it until you either develop a problem like genital warts or certain cervical cancer.
But the bigger issue here was oral sex causing throat cancer. And I don't know if have you guys seen the oral condoms?
Yes.
Those dental
The
dams?
dental dams.
They're
Yeah,
dental
they've been
dams.
out for a long time.
They're not that easy to use.
No, I don't.
Which is why the vaccine.
They're not flying off
might
the
make-
shelves.
Would you like to tell us some more about that?
Yeah, and on that note, we're going to wrap this up.
Yeah, just wrap it up.
That's all right. You guys have been excellent, awesome. Thanks
Thank you for having us.
all your great advice.
Thanks for being so frank.
Yeah, that's right. We'll be right back with more Daytime right after the break.